Good day, friends. Today I want to talk about lipid profiles, hypertensions, and heart attack. Why? Because this September we celebrate as World Heart Month. Basically, on 29th September there is a World Heart Day. So we celebrate the September whole as World Heart Month. Now, let me take some small steps to start with. First, we talk about hypertension. Normally, hypertension means increase your BP up to some extent. Accordingly, the normal BP range in India we expect as 140 and 90. 140 is the upper limit and 90 is the below limit. There are some situations where this does not exist, as if the people have diabetes or heart problem, then normal BP will be considered as 130/80. More than that, we have to take medications and do the other things. Now, the symptoms of hypertension mostly rare. There are no symptoms at all. And because of that, hypertension is a silent disease. And more than 60% of cases of hypertension, the people found with stroke and attack, heart attack. So after 40, I always recommend to check BP once at least in a 3 or 4 months. If not with your physician or nearest doctor, with a digital machine is as good as anything. If you think that your BP is high, then you have to go with a doctor for further investigation. Now, the symptoms of hypertension, if they have, then there is a severe headache. Maybe there is some anginal pain, like that. The second thing is lipid profile. If you are obese, hypertensive, or diabetic, then have to check lipid profile once in a year. That is required very much. Second thing, if your cholesterol or triglyceride is high, then we have to undergo for further checkup and medications if required. The hypertension and lipid profile is directly connected with the heart attack. So, to prevent the heart attack, to control the hypertension and lipid profiles, we have to do some normal things. First is the lifestyle modification. That is the base. So, what should we do to change our habit? So, obviously, first is the sleep. Minimum 6 to 7 hours of sleep is required. Second is avoid oily diet, fat diet. Take as much of as possible as fiber diet. That is very important. Third one is exercise. Minimum 30 minutes of walking. That is good, or anything. Yoga, and definitely yes, meditation is a must, because more or less hypertension, lipid profile, or heart attack is directly related to stress, and in this era stress is the first number of the cause of any disease.